Hi everyone, and welcome back to Patient-Centered Medicine, Episode 2. Today we're diving into the first component of patient-centered medicine, exploring the patient's illness, health, disease, and illness experience. As you prepare for clinical rotations, remember that effective patient care requires more than just diagnosing and treating disease. It's about understanding the whole person, including their unique experience of illness. And a crucial part of that is recognizing and responding to the patient's cues. This episode focuses on understanding the core concepts of health, disease, and illness experience, and how to identify and interpret these often subtle signals from your patients. Let's start with definitions. Health, according to the WHO, isn't simply the absence of disease. It's a resource for living, encompassing the patient's own perception of health and their ability to achieve what matters most to them. Disease refers to a medical diagnosis, an objective assessment of a condition based on medical knowledge. Illness experience, on the other hand, is the patient's subjective experience of being sick, including their physical, emotional, and social distress, how they interpret their symptoms, and how the illness affects their life. These three concepts are distinct but interconnected. A patient might feel unwell even without a diagnosable disease, or they might downplay a serious illness if they're still able to live a fulfilling life. Your job is to understand what health means to each individual patient, and how their illness, diagnosed or not, is impacting their pursuit of their goals. The patient's illness experience has four key facets. 1. Interpretation. Patients have their own unique understanding of their symptoms. Two people with the same abdominal pain might interpret it entirely differently, one blaming it on a spicy meal, the other fearing cancer. 2. Expectations. Patients come to the clinic with expectations. They might expect a diagnosis, treatment, a listening ear, reassurance, or something else entirely. 3. Feelings. Illness evokes a wide range of emotions: anxiety, fear, anger, sadness, relief, and more. Understanding these feelings is paramount for delivering compassionate care. 4. Impact on function. Illness can disrupt many aspects of a patient's life, including their ability to work, perform daily tasks, engage in relationships, and pursue their hobbies and interests. Now, how do we explore these facets? By paying close attention to the patient's cues, those subtle signals that tell us what's truly going on. These cues can be verbal, nonverbal, or contextual. Lang et al. 2000 offer a useful framework, categorizing verbal and behavioral clues into 5 types: expressions of feelings, attempts to explain symptoms, speech patterns emphasizing specific concerns, personal stories relating to illness, and behaviors suggesting unresolved concerns, like resisting treatment recommendations. Levinson et al. 2000, in their research with primary care physicians and surgeons, found that doctors often miss crucial emotional cues, even when patients repeatedly express them. This can be incredibly frustrating for patients and damage the patient-doctor relationship. Levinson et al. Highlight the importance of recognizing both direct and indirect comments about life circumstances and feelings. Nonverbal cues, such as tears, sighs, or changes in breathing, can communicate powerful emotions that the patient might not be able to verbalize. Pay close attention to body language too: eye contact, fidgeting, and whether they seem to be avoiding certain topics. During your clinical rotations, practice active listening. Be observant. Look for those subtle clues, both verbal and nonverbal, that patients provide. Think about Lang and Levinson's research. When a patient describes their symptoms, ask yourself, what's the real reason for their visit today? What are they really trying to tell me? For example, a patient complaining of a sore throat might actually be more concerned about missing an important exam. Explore their concerns with open-ended questions. What are your thoughts about this? What are you hoping I can do for you today? And how is this affecting your daily life? In this episode, we discussed health, disease, and illness experience, the 4 key facets of a patient's illness experience, and the importance of recognizing and responding to patient cues, highlighting the research of Lang et al. And Levinson et al. Attentive listening and a deep understanding of the patient's experience are essential for patient-centered care. Join us next time as we explore the second component, understanding the whole person, individual and family.